Hi, everybody. This is Holly Hink, pediatric nurse practitioner at the Dellrange Pediatric location. And of course, Dr. Kaduri's here with me from our Laramie Pediatric location. This evening, we're going to be talking about croup. And we hope that if you have questions or thoughts or concerns, just chime in anytime during this discussion.
Hi, I am Dr. Vijaya Kuduri. I'm a board certified pediatrician currently practicing at Laramie Pediatrics in Wyoming, and I have been practicing in Wyoming for the past 14 years. So today, let's talk about croup. This is the common childhood illness in young children, especially very common during this time of the year. Hence, we picked the topic today. Giving a brief introduction of croup, croup is a condition which causes swelling in the windpipe as well as the voice box that in turn causes some swelling and constriction, narrowing of the upper airway below the vocal cords that makes it breathing very hard as well as noisy. So that's what croup means. And it is common, it can happen anytime during the time of the year, but it is very common during this time, which is like fall and early winter months. And croup commonly affects children between the ages 6 months and 3 years of age, but it can also less commonly affect older children because their airway is much more larger and the swelling is not going to be in the way of their breathing. Hence, it's less common. If at all they're exposed to these croup causing viruses, they can just have a cold like symptoms like any other viral illnesses. So, Holly, do you want to talk about what causes croup?
Yeah, absolutely. So, croup is typically caused by viral illnesses. Now, as Dr. Kaduri mentioned, fall and winter is kind of the peak times that we see kids present with croup, and it can be from multiple different respiratory viruses. So, we've got things like parainfluenza, RSV, we've got things like regular influenza. And since COVID, we've seen a lot more children present with croup being caused from COVID, which, as we know, is a viral illness as well. And what else? I know you're going to kind of talk about symptoms.
Right now, we are seeing a lot of flu A, flu B. Those viruses can also cause adenovirus, RSV.
Adenovirus, that's right. Yep.
These are the common causes of viral croup, but sometimes bacterial infections like diphtheria, Staph aureus, all the ear infection, sinus infection causing bacteria like Staph aureus, strep pneumonia, Haemophilus influenza type B, all these bacteria can also cause croup. Coming to the symptoms of croup, so as Holly said, viruses are the most common type, and this viral croup presents typically like a common cold-like illness, and eventually it can slowly become more evident with symptoms like barky sounding cough, hoarse voice, noisy breathing, and sometimes, a small sound, musical sound, coarse breath sounds that can be heard while breathing in, commonly called as stridor, is evident in some children with croup as well. Children with mild croup can commonly have this stridor, especially with the activity and when they're crying. But if we at all see a stridor that's happening with every breath, even at rest, is a sign of more severe croup and needs to be evaluated right away. You should call 911, take the child to the emergency room for further evaluation and management. Coming to the other kind of croup, with the viral croup, the low-grade fevers are also common, but sometimes you can see fevers as high as 104 degrees Fahrenheit very rarely, but most commonly is the low-grade fevers. The other type of croup is called spasmodic croup. It is thought to be occurred because of not the viruses, but it is more commonly caused by any allergies or if the child is having any reflex of stomach contents like any acid coming up can also cause this croup like symptoms. It can be very scary because it can happen suddenly, especially in the middle of the night. The child can go to bed perfectly normal and suddenly wake up in the middle of the night gasping for air, having a hoarse voice, noisy breathing, and stridor. So it can be very scary presentation. With spasmodic croup, because the cause is not the virus, these children will not be having any fevers. And also the cause is, not the virus, it's more of a chronic problem like reflux or allergens. It can also recur from time to time.
Mm-hmm.
So these are the common presentations of the common groups we see. And Holly, do you want to give some information on diagnosis of group?
Sure. I'm going to play, as we talk about symptoms, a couple of things I always ask the families, when they come in. Obviously, when we see a child with cough, we ask them, what does the cough sound like? And I'll ask him, is it sound wet or mucousy or dry or hacky? And when we think about croup, as Dr. Kaduri mentioned, it's a seal-like barky cough. And sometimes we don't know sometimes what a seal sounds like when we discuss that. The other thing I'll ask the family is when she was talking about stride, or like they're making that bizarre sound when they breathe in. It typically is worse at night. So I'm hoping y'all can hear this. I found a really good sound clip that's a child with croup. So that sounds bizarre, but that is a really distinctive sound of croup. And as Dr. Kaduri said, sometimes it's just more so in the evening hours, but she and I get more alarmed when we have kids that sound like that in the clinic or that have that very, very hoarse voice in the clinic. So diagnosis for us typically is just clinical diagnosis based on what you as the families are hearing at home, based on what we're hearing here in the clinic, and depends on the severity of the symptoms and kind of what we need to do next in regards to management of those symptoms.
And these neck X-rays to diagnose croup is rarely required, especially when we have a diagnosis that's in question, like, if there is something else that's going on, we are suspecting, or if the child is having a atypical presentation, like, and not responding to the regular treatments of croup, then we can, thoroughly investigate what else is crossing on. But the neck X-rays is another thing we use not often for diagnosing croup. Yeah. Talking about the treatment, so we at the clinic more often use steroids, more commonly dexamethasone. It's a longer acting steroid to help treat these croup illnesses. It will resolve all the swelling in the upper airway. If the child is really sick, having stridor at rest, these children, or any difficulties with breathing, these children will need a breathing treatment with racemic epinephrine, and that will resolve the swelling very quickly. I'm going to give you some home remedies for all the moms who are having a child at home, who are having presenting with croup-like symptoms, who are waking up in the middle of the night and they don't know what to do. So the first and foremost thing is, I would recommend you to make sure that child is try as much as possible to keep the child calm, which can help with the breathing of the child better. So few tips for keeping them calm is, you can give them a hug, you can do a back rub, and also you can sing their favorite bedtime song, and you can also try to use some comforting words like "mommy is here," "you'll be fine," "you'll be all right." All those comforting things should help. um, Other things you can try doing is treat the fevers, if in case the child is having any fevers, with Tylenol or ibuprofen, and also make sure the child is well hydrated to prevent dehydration. And my favorite treatments that really helps, children with difficulty breathing with croup in the middle of the night, is hot steam inhalation. I usually recommend families, if they identify the child is having a barky sounding cough pretty early, make sure you sit with the child in the bathroom filled with hot steam for 20 to 30 minutes before bedtime. And also You can run a cool mist humidifier bedside within 2 feet distance from the child's head. And the other things you can try if despite everything, despite the steroid, hot steam inhalation, cool mist humidifier, if the child is still struggling to breathe. One thing you can try before going to the emergency room is you can bundle up your baby and expose him to the outside cold air. Several moms have noticed improvement in symptoms. There are no studies to prove it, but
Mhm.
most symptoms will be gone, especially the difficulties with breathing will be better if you expose a child in the cold air. I have another remedy for the cold air exposure is you can actually open the refrigerator in your kitchen,
Yeah.
and you can actually have the child inhale the cold air from the refrigerator. And other remedies are, you can put a warm washcloth on the child's nose and mouth to help them have that moisture or the mist while
Mhm.
breathing in. So you can try all these measures at home as well.
Yeah, I agree. That's exactly what I have families do. I'll tell them to have them breathe in some hot steam from the bath or the shower for a period of time, and then you could take them out, open that cold air, open the door and let them breathe in that cold air because that will relax that upper airway.
Yes, yes. Holly, do you want to give some guidance on when for these families when to seek medical attention?
Well, that's a great question. I think, Dr. Kaduri, as you mentioned, I feel like it's all depending on how well the child is breathing, if they're comfortable, if the child is drinking well, but really watching them for that stridor that Dr. Kaduri mentioned, that like they're breathing in, and the the more swollen that upper airway gets, the more stridor they're going to have and the more struggle they're going to have with their breathing. So, of course, things that we call retractions would be sucking in here at the trachea, in between the ribs, under the rib cage. And it kind of depends on the work of breathing and how well that child is doing, on if you need to seek medical care, like tonight, for instance, if you need to go to the emergency room. Or, of course, if it's during the day and they're not as urgent, obviously call us. We do same day appointments at either clinic. If you're sitting on the fence about what to do, we are both on call for our clinics. If you needed to call either of us in the evening hours or on the weekends, if you're sitting on the fence whether you need to take your child to the ER or not, please give us a call. We are really easy to work with. We can try to help problem solve over the phone. If we needed to FaceTime or if we needed to listen to your child breathing, we'd be glad to give you some insight, because it is scary in the middle of the night when you have a child that's struggling to breathe. We all want them to be okay. So never hesitate to call us if you're trying to figure out what's the next best step.
Absolutely. And we are available 24/7 on the phone call.
Absolutely.
Yeah.
Yeah.
And a couple other things I would like to add is, if the child is not able to talk and coughing and not able to talk, that is one of the important sign as well. And if you see a lot of drooling coming from their mouth, that also tells us there is some obstruction going on and the child needs to be evaluated. Call
Yeah.
911 right away if you notice any of these things. In addition to any purple discoloration of the lips or, of the nose or around the nail beds, all these are signs you need to keep an eye if the child is really struggling to breathe. And do not wait for the clinic to open the next day morning. If you notice any of these severe signs, just call 911 and take your child to the emergency room. I want to share one thing. Seeing these children in the emergency room, especially during my residency, I see these croup babies coming to the emergency room, pediatric emergency room, the via the ambulance, via the EMS, with the concerns of struggling to breathe and all the severe symptoms. But by the time they reach the emergency room, because they're exposed to the cold air and route to the emergency room, they look very happy, healthy, smiling. So, so the cold air exposure really helps by the time they reach the emergency room. So you can try that one thing before going to the emergency room.
Absolutely. Oh, and one other piece, as you were saying that, I thought of, albuterol will not help croup. So
Exactly.
an albuterol nebulizer and albuterol inhaler is not going to help with the croup, because, as we discussed, it's going to be most likely a virus or a bacterial infection in that upper airway.
Exactly. Talking about the wheezing, especially in the upper airway, hearing to the wheezing sounds, albuterol is not recommended. So that wheezing is entirely different from the wheezing with the lower airway inflammation. So albuterol is not will not improve any croup babies. So let me talk about few complications of this croup. Vast majority of children with croup, they recover fine with no complications at all. There are certain children, especially who are born prematurely, as well as who have a chronic lung condition such as asthma or neuromuscular conditions like cerebral palsy. They are the ones who get severe croup and needs to be hospitalized. Very, very rare complications of croup will be like a bacterial infection of the upper airway and dehydration.
Mm-hmm.
Yeah. So, Holly, do you want to add anything else from
No, I don't think so. No, I think this was great. So,
lately? Like I see at least a
yeah,
minimum of 3 to 4 patients every day. So,
right, right.
yeah.
Well, and again, as we mentioned, I'm at the Cheyenne location. If y'all don't know me, I didn't tell you what my title is. I'm a pediatric nurse practitioner here. The Kaduris brought me on a few months ago. I've been in pediatrics for 25 years, and myself here at the Cheyenne location or Dr. Kaduri, either of us are glad to help in any way. Please don't hesitate to call us with questions. Again, we do same day appointments. We're available, after hours in the evenings and on weekends. And if there's anything that we can help with, please let us know.
Absolutely. And I would like to thank Holly Hink and all the families and mothers who are listening to us.
Yeah.
And until next time, take care. Bye bye.
Yeah. Thank you. Y'all have a great night. Thank you so much.
Bye, Holly.